Wearable technology is one of the fastest growing industries in the world. From Fitbits to smartwatches, the data is rolling in. And Professor Reed Ferber from the Faculty of Kinesiology at the University of Calgary wants to harness that data and use it to improve our health. And he joins me here this morning. Good morning to you.
Good morning. Thanks for having me.
Thank you so much for being here.
Absolutely.
So there is so much wearable tech out there right now. Can you walk us through some of these and really what kind of data they're collecting?
Absolutely. So we've kind of arranged a little sample here. So, you know, from the simplest of devices, this just monitors how many steps you've taken.
Sure.
And this is a Fitbit, but this has been shown to be scientifically valid.
Mm-hmm.
So we are able to glean scientific data from these instruments. And then this little device measures how much your center of mass or your pelvis moves up and down and rotates. And we're seeing it woven into the fabric of our socks and shorts now, and then we go all the way up to, of course, most everyone has a smartphone in their pocket, and that is monitoring them. It's monitoring their steps and where they are. And then we can go all the way up to smartwatches. So this has GPS-enabled capabilities. So, you know, within a half a meter, we know where somebody is. We know what their heart rate is. We know what their overall biomechanics are like in terms of how they're behaving at that point in time.
Right. So how accurate is this data? So you've got the data, but is it actually true and accurate?
Yeah, these are scientifically valid instruments.
Wow, this is incredible. So what do we do with all this information?
Well, what's happening is that we are driving a large initiative on campus at the University of Calgary. It's called the Sensor Technology in Monitoring Movement. So at the end of the day, what we're trying to do is tag people like wildlife and monitor them out in the real world.
Okay.
So this, for example, is a scientific device that can log data, high fidelity, highly sensitive scientific data for 12 hours at a time.
Wow.
So we're putting this on people, and we're trying to understand, well, right now we can predict who will and will not respond to 2 months' worth of rehabilitation.
Really?
So before they even start rehab, we use these devices. We have them walk back and forth. They fill out some questions, and with about 85% accuracy, we know whether they will respond or not. So we're getting the right people, the right care at the right time. We're using it to predict injuries before people even feel pain. So that's where
whether or not they're going to get an injury?
Exactly. That's where we're driving towards. So we're still in the early stages of this.
Sure.
But that's some of the research that we're doing. And then even using the simplest devices. So Fitbits, Garmin's, other devices, they're fantastic at celebrating 10,000 steps.
Right.
As an example.
Sure.
But for somebody with knee osteoarthritis, they should be celebrating 6,000 steps because that's a really big day for them. So that's what we're trying to do.
Okay.
We're trying to take these devices that provide us simple metrics and are usually aimed at fitness and activity monitoring.
Right.
And we're trying to aim them towards healthcare.
Okay. So that's a pretty big hurdle, though, isn't it, to actually take that information from the general population and then get it to the patients and the healthcare providers?
Well, it is. So this is not just researchers working with industry.
Okay.
This is researchers working with industry and government and insurance companies and healthcare providers and the public. So this takes a large effort to get all these people in the same room.
Right.
We had a workshop last week, which was our first attempt to do exactly that.
And how did it go?
Well, I thought it went fantastic. So we had over 100 people attend. We had people from government, from industry. We had lots of researchers there. And basically, it was just to make connections.
Right.
That was the whole point of it. So we'll do it again next year, and we'll just keep on
going until we can make this data more applicable to all of us.
Absolutely.
Fantastic. Thank you so much for being here, and good luck with this research. And come back and tell us more about it when you've got more data.